Riverlee is a needy community situated in the southeast of Johannesburg, reasonably close to the Doornfontein campus. After every weekend, the clinic opens its doors for the community patients, and our sonographers are ready to put their theory into practice, with the antenatal ultrasound screenings resulting in a huge success.
We come on a Monday morning, yeah. So you'll see they check the card, they all sign a consent so that they know the students who are doing the scans and that they agree to it.
Diagnostic ultrasound, or sonography, is a discipline which employs high-frequency sound waves to produce images of internal body structures.
I need to write a report on the session today.
During an ultrasound examination, a small electronic device called a transducer is placed on the patient's skin over the area of interest. The transducer produces sound waves that penetrate the body.
Good.
When the sound wave strikes a tissue boundary, echoes are produced. The returning echoes are detected by the transducer and then electronically converted into an anatomic image which is displayed on a screen.
Contrary to other radiography students who only produce the images and the radiologists interpret the image, the ultrasound students must do both and make the diagnosis. Therefore, their knowledge base has got to be much broader than a diagnostic radiographer, and their responsibility level is also much higher. Surgeons will act on their word, on their report that they give.
You know, you expand on your knowledge a lot more because of all the responsibility you have now. So you think twice before you act, if I can say that.
They do not just do antenatal scans, they learn to interpret every single part of the body. So it's from a baby brain to the internal organs, to a pregnancy, to the muscular system and muscle attachments and injuries, sports injuries. It's a very, very wide scope. So we basically start by saying to them that your knowledge of abnormal will depend on your understanding and knowledge of normal. So by just measuring that tiny little skin fold behind the baby's neck, you can exclude Down syndrome.
Previous students that practiced in the same practice told us, you know, it's hectic, you have to commit time management, all of that. But actually going through it is a different thing.
It's a 2-year course, but it's post-basic. So they are all trained radiographers, and then another 2 years. We revisit everything. We have to revisit anatomy because they have to know their anatomy inside out. We revisit pathology and also physiology. Now they need to understand how the body functions and what changes when there's an abnormality.
Our Health Training Center is an active learning hub. The work sonographers do impacts what nurses do in that the sonographers date the pregnancy so that the nurses know how to handle the pregnancy forward.
We take it back to Sister Shirley and discuss with Sister Shirley the situation. So the sisters here, I think, appreciate the service very much.
The faculty is also the first health services training center to develop a pioneering clinical simulation training facility.
We have done a lot of work in the sim lab, and it does help because we get shown, you know, small basic tricks to the technique that we can use in practical or in the clinic.
This work readiness focus is further enhanced by placements in relevant service rendering facilities who are accredited by the university and relevant regulatory bodies. Our students have a high placement ratio in their respective service domains.
They get respected by the radiologist because they function in the sphere of a radiologist. So the radiologists see them as colleagues rather than as employees.
When the radiologist needs to do an ultrasound, they just pull up their shoulders. I can't anymore. I can't remember.
Yeah, we'd actually depend on us, actually.
People waiting for that.
Until after October, after our final exam, basically working, studying, and all the assignments and projects are keeping us busy. So not much of a social life at the moment.
This is the ultimate goal. One day we would like to open our own practice, which they can do, but they need to have at least 2 years of clinical experience before they can apply for a license to open their own practice. And I think they all realize that 2 years experience once they're qualified is not really enough to stand on your own. But it's an interesting profession. It's challenging, but it's interesting, and it changes you and the way that you think, that you act. It builds confidence.
With a focus on producing competent and innovative practitioners, the faculty provides an engaging learning experience within the context of problem-based learning with real-life experiences in the clinic.